Welcome. I'm Dr. Arlen Meyers, and say hello to my guest today talking about telebehavioral health, Mark Nolte.
Hi, how are you, Dr. Meyers?
Hey, Mark. Thanks a lot for taking time to inform us about telebehavioral health. So needless to say, COVID epidemic, telemedicine, all that is pretty hot right now. And I wonder if you could tell our viewers a little bit about yourself and how you got into this.
Yes, so back when 2010, I was diagnosed with depression, and I tell people I was one of the lucky ones because I went and got help and now had a much happier and productive life. But going through the process, it made me realize how antiquated the system was and how it needed to be, brought up to speed to make it easier and more accessible for people to get teletherapy. And back in 2018, 2010, Obamacare came in, and without getting into politics, I was in the medical device business and decided to get out of that because I didn't see much future in it, and decided that teletherapy was the future. So between those two things, that's what made me decide to get into teletherapy.
So your background was really in medical device?
Yeah, I worked for Ethicon, a Johnson & Johnson company, selling the trocars for laparoscopic surgery, and then for 7 years, and then I worked for Stryker Endoscopy, selling all the video equipment used for arthroscopic and laparoscopic surgery, and then had my own medical distributorship, Mark Medical, for about 13 years, being an independent distributor of medical devices used in the operating room. So I was pretty much in the OR every day working with surgeons.
Sorry to hear that. So maybe you can tell us over the next maybe 10 or 15 minutes why telebehavioral health during COVID.
Yeah. So if we can bring up the slides. So this is just kind of my introduction slide. Again, my name is Mark Nolte. I'm CEO and founder of Start Talking, and we're trying to destigmatize mental health through teletherapy. And we can have the next slide, please. And so I like to start out with just quoting some numbers. In the United States, 1 in 5 Americans suffer from some mental health issue. And of those diagnosed, only 38% actually receive therapy. So you may be saying, next slide, please. So why are over 60% going untreated? And there's 3 main reasons why people are going untreated. One is the stigma associated with therapy and admitting you've got a problem. 2, the fear of going to the therapist's office, parking your car in front of the therapist's office, going to the lobby, and the fear of running into someone you know, either a coworker or a neighbor or something like that. And the third thing is the fear of the employee, the fear of their employer finding out that they have a mental health issue and they may get fired or demoted from their job. Now, Dr. Meyer, you and I know that's not the case, but some employees have that fear. So that's what made me help develop Start Talking. We're a HIPAA-compliant encrypted video platform that allows therapists to provide teletherapy. And this is a slide I like to show. This is a study that was done in 2015, and it was done by Rochester Medical Center. And this is for telemedicine, not teletherapy, but still I think it holds true for teletherapy. You can see the bottom line are virtual visits, and the top line, red line, is physical visits. And they were predicting back in 2015 that in 2024, virtual visits would surpass in-office visits. Well, now with COVID-19, you can take that apex that crossed in 2024 and put it right now into 2020. In other words, accelerated this whole process by at least 4 years it was coming. Next slide, please. So, and this is an article that I wanted to share that's out of Forbes magazine, I think it is. And they're saying that the next or second pandemic will be mental health from COVID-19. And as you can see, that the second epidemic will be mental health for more people than expected that the healthcare system can take care of, leaving employers to pick up the slack. Everyone's looking for virtual telehealth healthcare right now. And depression alone costs employers over $100 billion each year, mostly missing work or low productivity. In other words, absenteeism, or what we call presenteeism. In other words, being at work but not engaged. And you can see these companies below here, Cisco and Visa and PayPal. They've had a 15 to 20% week-on-week increase in mental health and stress-related appointments since mid-March, and then a 30 to 50% boost in the new client interest. Next slide, please. So this is the potential of the market. There's now Americans are spending about $200 billion a year to treat their mental health conditions, and only there's half a million therapists in the United States. And before COVID, about 10,000 or 2% of them were actually doing teletherapy. And in the rural areas, 86% of the counties in the United States are underserved. In other words, they have therapists, but there's not enough therapists. And then 55% of the counties in the United States have no service at all. I come from Kansas, and in western Kansas, there would not be a therapist for entire 6 counties. So this makes it easier, more accessible to get teletherapy. And the growth for millennials is huge. I'm a baby boomer myself. It's not so much my generation that'll adopt this, but it will be millennials, because they're going to become the largest. This year they are the largest majority of the workforce. It used to be my generation, the baby boomers, but as they're retiring, they're not as many. So, and they want to do teletherapy. So we need to cater to what they prefer. And COVID-19 has accelerated that process of acceptance and doing teletherapy. Next slide. So this kind of shows the total addressable market. It's about $300 billion, and 2.6 billion is that in teletherapy. And then we're looking to expand beyond into 10 states and doing about 104 million in market share. Next slide, please. And so this is kind of a graph, kind of talking about our competition. There's Talkspace, which they're a very large company out of New York, and they do most of their therapy through text messaging, secure text messaging. That's their primary way of doing teletherapy. They're a direct consumer model. There's been some controversy by people on the clinical side that whether text messaging is a valid way to conduct therapy, if it's effective. And that can be your choice to decide if it is or not. They do a little bit of video, but mostly it's text messaging. Doctors on Demand, they're a telemedicine company, but they've also bought a company and advanced into teletherapy as well. And then BetterHelp, they're a business-to-business model, but their way of doing therapy is either through text messaging or by video session. And the way they pay their therapists, and they measure it by words. So if a therapist speaks or texts 1,000 words, they get paid $15. And if they text or speak 2,000 words, they get paid $15. And people may say, well, is that really an effective way to measure the effectiveness of therapy? I'll leave that up to the experts. And then, so Start Talking, we're not a direct consumer model, but we're a B2B model. And so that's kind of where our market is. Next slide, please. So this is just a quick slide. Some of the competitors out there, the number of visits they have per month, and also how many therapists they have on board. Now, this is kind of a data slide, so I'm sure it's more than what it is here, but it kind of gives you an idea. Next slide, please. And so the last thing I'd like to say is that COVID-19 has been the game changer. In other words, I say welcome to the new normal. And what used to be teletherapy was a nice thing to have, but now it's something you have to have. It's no longer a luxury. And what was inevitably going to happen is accelerated by 4 or 5 years from you saw from that graph. And the other thing too is that teletherapy is here to stay. And whether it's purely going to be teletherapy or some hybrid model where they're actually doing a combination of in-office visits and teletherapy, that might be where it's going. But I can tell you, with working with some of my therapists in San Francisco, they don't see themselves going back to the office for probably close to a year, and they're starting to give up some of their long-term leases because of that, and just going straight to teletherapy. So that's just a little bit of a snippet about Start Talking and what we're all about.
Great. So that's a good introduction to the why and why this thing is taking off. Let's talk a little bit about the what and the how. You've introduced a little bit in that competitive diagram about what you do compared to other competition. Can you give us a little sense of why you decided? Well, first of all, can you kind of walk us through what a typical patient would encounter if they were to use your service? In other words, can you sort of walk us through the workflow?
Yeah. So if you go on our website, you'll see 16 therapists listed on the website, and you'll see their picture, a profile of their actually, what they kind of their philosophy on therapy, and what EAPs or insurance companies they're credentialed with, and kind of what they specialize in. Then if you like this this therapist, then we have a booking widget, which actually you click on that and it will actually bring up the therapist's actual calendar, and you can go on there and schedule an appointment with a therapist without having to make a phone call. And so it alleviates the need to play phone tag with a therapist. Millennials don't want to make a phone call, so anything you do to make it more easier and to get an appointment, it can be done. So once that appointment is scheduled, then they get a hyperlink for a 9-digit ID number. We use the Zoom HIPAA-compliant encrypted version of the video. And then their appointment's at 4 o'clock on Thursday. Then they would click on that and do a Zoom session. And typically they are for an hour session. And we do a lot of EAPs, employee system programs, and they usually get 5 sessions, no questions asked. And those will be for an hour, at least a 50-minute session, but mostly an hour session.
So some therapists say that a lot of therapy and finding a therapist has to do with the right fit, because it's not uncommon for people to say, well, I've tried it a number of times and it just didn't work. So in your platform or other platforms like it, do you get like a free coupon or a free trial offer or a complimentary initial half an hour consultation just to chat and see whether this person is a right fit?
Yep, that's a great question. So you'll see when you go on the website and click on their profile, you'll see that quite a few of them offer either a 20 to 30-minute phone call session at no charge. And that way to see if it's a fit for the patients. In other words, let's say the person says, well, I want to be seen for depression, for example, and the therapist actually finds out that they actually have a substance misuse issue, and they really need to see a licensed addiction counselor and not maybe a therapist that would normally see depression. So you can kind of figure out if it's a fit that way. And then also we have some videos on a couple of my therapists have videos, and they can actually watch the video of the therapist. And so it gives them kind of an introduction of the therapist, their personality, and see if there would be someone they'd want to work with.
We got a question from John Soloninka, who happens to be our Toronto SoPE chapter leader. His question had to do with integration with EMR. So do you integrate with an EMR? And if so, to what extent is that important or not?
Yeah, so we use a practice management software called Simple Practice, and what it does is it does all the therapist progress notes, which is basically the notes of the therapy session, and those therapy notes can be uploaded to an EMR. Now it goes most likely as a PDF file attached onto the EMR, but as far as integrating populating a record or whatever on an EMR, it doesn't really do that. But we can upload the patient progress notes to the EMR.
I see. Can you tell us a little bit, and we can get some more into sort of the nuts and bolts of this, but our viewers are always interested in sort of the entrepreneurial story. So you told us you actually, I mean, you had a personal situation.
Right.
You told us that your background was not in as a professional therapist, and that you, I assume, were in sales and marketing with MedTech.
Right.
Right. So it's not a far leap, but it was a leap, I imagine, to do this and go out on your own. So what can you just kind of, I mean, it's obviously going to be a long story, but give us the short version as to,
Yeah.
tell
Well,
us the creation story and what entrepreneurs should know if they decide to do something this or something similar to it.
yeah. So this all, I mean, besides my personal story, this all happened back in 2012. At the time, I lived in Kansas City. I moved to Denver, Colorado, here 3 years ago. And back in Kansas City in 2012, Kansas City was the first city in the United States to get Google high fiber cable internet. And so Google put on a weekend hackathon to find different services or different businesses that would require high-speed internet, like a Google speed. And so I thought it was interesting. I was looking to make a move out of medical devices, again, because what I saw, the future of it was not very promising. And so it started on a Friday evening, went late Friday evening, all day Saturday, and then on Sunday night, we actually presented our product. Well, a nonprofit organization out of Washington, D.C. said, we really think teletherapy is going to be the future. And Mark, would you be willing to head up this group of people that's interested in doing teletherapy for the weekend for the hackathon? And so we kind of came up with a name, and it was some Greek name for getting help or something, and we put it through a makeshift video on how it would work and all that stuff. And there was probably 6 people that were involved with that. And I decided to continue with this. And I asked the other 6 people, I said, would you like to continue working on this? Because I'm going to make this, I'm going to take it further. And the other people either worked for medical institutions or whatever and had full-time jobs and couldn't do it, which I understand. But there was one other guy that was a tech expert and did video, and he said, yeah, I'll do it. And his name's Jim, and we became co-founders there in Kansas City. And so kind of out of that hackathon, was born Start Talking. And then we got accepted into an accelerator back in Kansas City. It was for like 90 days and got about $20,000 of money, and they got 6% equity in the company. Since then, Jim and I are still friends, and Jim still does the work on the website, but because we're bootstrapping, Jim had to go a different direction to make income. And so we kind of just parted ways towards the corporation. We closed the one in Kansas City, and I decided to move here to Denver, like I said, in April of 2017, and reincorporated in Colorado to do teletherapy.
So you've been at it now for how long?
Probably a good 5 years.
Now, did I hear you correctly? You said that your revenue was over $100 million?
No, it wasn't no. I wish.
That was that's what you
That's
envisioned.
our goal to get. I'm
I
sorry.
see.
Yeah, that was our target to get 10 states.
I see.
Yeah, that's our goal. Yeah. So basically, we're in Colorado now. We've got 16 therapists. We've expanded to California and Texas and Wyoming. We're looking to go to Oregon, Washington, D.C., and then after that, New Jersey. So we want to get 10 states under our belt. And the reason you say, well, why those states? Well, those states, according to the employee assistance programs, EAPs, had the most demand for therapists, and yet didn't have enough therapists. So that's why we targeted Texas and California and kind of went from there.
Who is your typical patient? Is there a demographic or a certain?
Yeah. So the interesting thing about EAPs is the patient's going to get somewhere on the average around 5 to 6 sessions. And these are people who are employed, but they've had a life stressor. In other words, they've had a divorce, maybe a death in the family, loss of income or something like that. And they maybe didn't have a mental health issue before, or maybe a little bit of, but now they've kind of slipped into maybe some depression, anxiety. And they just need a few sessions to kind of get them over the speed bump in life. And so it's people from mild to moderate mental health issues, mild to moderate anxiety, mild to moderate depression. They're not typically your people who have severe mental health issues. Let's say, for example, bipolar with schizophrenia. And so a lot of the therapists like this EAP market because, again, it's a lighter therapy or more easy to deal with than it is long-term therapy for some more severe mental health issues.
And the people who are giving the therapy are clinical social workers, social licensed therapists.
Yeah, licensed professional.
We're not talking about psychiatrists.
No, no psychiatrists. We don't really do any kind of prescription of drugs. These are all anywhere from a licensed professional counselor up to licensed clinical social worker, which is a master's level, up to PhD psychiatrist, or I'm sorry, psychologist, but no psychiatrists.
So 2 categories of people that sound like they need help are health professionals and entrepreneurs. Because it turns out that actually, and we've written a lot about this and talked a lot about the entrepreneurial mindset and the entrepreneurial psychology or pathopsychology, which has a good news, bad news side to it. So are you seeing hospitals, health and care worker employers offering telebehavioral health services to frontline or not frontline healthcare workers?
Yeah, so if I brought up one of our screens and showed you, because we're licensed in Colorado, we're doing all the major hospitals in the Denver metro area for therapy. We've even got a fair amount from Children's Hospital here in Denver. So we are seeing a higher concentration in the for hospitals for their employees needing to address mental health. And the interesting thing is up till now, it's been more of a fight or flight type thing where they've been so focused on taking care of people with COVID and all that stuff, they've kind of ignored their own mental health issues and not addressed them. Well, now they're starting to die down, at least a little bit here in Colorado. They're kind of, looking up for taking a breath of air and going, well, now I need to take care of myself. So we're anticipating fourth quarter of this year and even in the first quarter of next year, a huge surge of those mental health professionals finally addressing their mental health issues and getting that taken care of. As far as entrepreneurs, that's one of the things we specialize in. We've kind of worked a little bit with Brad Feld here in Colorado, especially in the rural areas of Colorado where they've got entrepreneurship. Because if you're a entrepreneur and you're raising funds and you have a team, the last thing you want them to know that you have a mental health issue. And so we're trying to make it more of a discreet, stealth way for these entrepreneurs to get therapy um, through teletherapy. So in other words, let's say you're in a rural community of Colorado, the last thing you want to do is go park your car or pickup truck in front of a therapist's office, and everyone goes by and says, "Hey, Joe, we saw your pickup truck in front of Dr. Smith's office. Are you going crazy or having issues or whatever?" And so they don't go. Or going in the lobby and run into one of your neighbors or a small town atmosphere. But they can get in their pickup truck, get on their smartphone, and do a teletherapy session, and no one has to know they're getting therapy. And so we provide that stealth, discreet way for them to get therapy without going through the traditional model of getting therapy.
Although you mentioned Brad Feld, and most of us in Colorado know him as a fairly prominent angel ecosystem builder. He's a pretty well-known individual in the entrepreneurial world, not just in our region. But he made a point of explaining to his followers that he was depressed. I mean, he took it upon himself to, I wouldn't say the poster child, I don't think that's fair, but he made it so that people understood that entrepreneurship is not easy and takes, in many instances, a psychological toll. And I think that, in fact, that message is coming out more and more. So I guess I would push back a little bit on your point. Like, I don't want to tell anybody that I have an issue. In fact, being authentic, revealing your true self, not hiding behind a curtain, et cetera, particularly during this time, I think you're seeing more and more of that. And I think people are attracted to it. Do you have a response to that?
Yeah. I mean, Brad Feld has been great about sharing his experience. I mean, if you blog and look for his videos, he goes and talks about 3 different times in his life that he experienced depression, severe depression. One was for a 2-year period when he was, in the thick of things, and then a couple other ones not too far distance. And he's opened the door, so to speak, to make it more acceptable. Hey, if you're an entrepreneur, it's understandable that you can have mental health issues, and it's okay, because I went through them. And I think that's very brave and very admirable for him to do that. I think we have to get rid of the stigma that's like, okay, well, it's a stressful thing as an entrepreneur, and it's okay to get therapy. And, maybe your investors or your team will not think any less of you because you're getting help. And
so let's talk about a little bit about some barriers to dissemination and implementation, and some issues that have been brought up, not just in telebehavioral health, but just in telemedicine in general, because everyone is saying, as you pointed out in the very beginning, the first patent for telemedicine was in 1924. 1924. So we're talking almost 100 years to get to where we are now. And people are saying, well, it accelerated adoption. You pick a number, 10 years, 15 years, 20 years, 5 years, whatever. And it remains to be seen how much will last after COVID goes away. So my questions have to do with that issue of what got in the way, what will get in the way, and what are the persistent barriers to adoption. So let me just kind of go through a list. So one is, and you can do a yes, no, or tell me as much as you want. But so the first one is telebehavioral health safe and effective?
Yeah, so there has been studies done now that show it's just as effective as doing in-office or in-person therapy. And also, there's a tendency for people to be more open doing teletherapy. And the reason is they can do it from the comfort of their home. They feel more comfortable versus going to a stranger's office and sharing your most interpersonal feelings. And so they're more open about sharing their issues and problems. And yeah, so there's been multiple papers written on it that will actually show that teletherapy is effective as well as cost effective.
What rules, regulations, and laws need to change to speed implementation and dissemination?
Yeah, great question. So the interesting thing is, as a therapist, you still have to be licensed in the state that the patient resides. So if I'm a licensed therapist in Colorado, I can only see patients in the state of Colorado. I can't see someone in California if I'm not licensed there. And I use the theory, if I'm in Denver here and if I drove cross country to California, I don't need a different driver's license to drive to California. So why would I need a different driver's license for, a different therapy license for each state? And it actually comes down to politics. These 50 different states, they have different requirements, and they want the fees, and it's not the most cost-effective thing to do it that way. And so I think what you're going to see, and you're already happy to see it, like nurse practitioners, if they're licensed in one state, there are 15 other states that they have reciprocity in to do telemedicine. And I think as time goes on, especially after COVID now, showing that this is very effective, that you'll see more that if you get a national license possibly and do teletherapy across the state. And we've got some therapists in California who are stopping their practice that they've done psychology practice for 30 years and becoming life coaches so they can cross state lines.
How do we address the issue of the digital divide? So by that, I mean people who have access to computers, broadband, technical support, and those that don't. And there have been many, many studies, particularly in rural areas, that indicate there's a number of people that simply don't have equitable access to telemedicine, let alone telebehavioral health. So what's the answer?
Yeah, so and I'm not just picking on Colorado, but they have them in every state. But like in Colorado, they have something that's been around for 20 to 30 years about getting better broadband access, and giving government funds and grants and stuff, to get better broadband asset with cable. And my philosophy is that forget cable or broadband, and the future will be 5G. So, which is easier, you put a tower up and you don't have to lay cable all the way through the country. You put a tower up, and with 5G, it's 100 times faster than 4G connection. So I know 5G is not here, but in the next 3 to 5 years, 5G will be pervasive all the United States. And I think that's the answer, is getting 5G so people can have better access. And even with our platform, it works well with 4G, and 5G would be even better. So I think it's looking at doing cell towers through the rural areas and getting 5G installed is the way to have equality and having access, and not broadband through cable.
And maybe satellite.
Yeah, exactly.
Okay. So how do we protect privacy, security, and confidentiality?
Yeah. The CARES Act is in place right now by the federal government. And, you, as a therapist, you don't have to have a HIPAA-compliant encrypted video platform to do teletherapy. You could use anything like Google Hangout that's not HIPAA compliant, and some of the other ones. However, I think after the CARES Act over with, it'll go back to having HIPAA compliance. So you don't want to use Google Hangout or FaceTime or some of the other services that are not HIPAA compliant. And so you want to make sure that your platform is HIPAA compliant encrypted, and that you have what they call a business associate agreement in place, which basically says that that company that's providing the video, that they guarantee that their service will always be HIPAA compliant encrypted, and that legally they're the ones that are liable to make sure it's always HIPAA compliant and encrypted, and that burden is off your shoulders as a therapist. If you don't have that business associate agreement, then you're legally liable to if there's some kind of hacking into the video or something like that. So you want to make sure you have a business associate agreement in place.
Who pays for all this?
As far as
the service. So for example, private insurance, Medicare, Medicaid, out of pocket, credit cards, whatever. I mean, because, obviously whenever you have a technology, the usual first question is, will my insurance pay for it?
Right. So here's what was going on before COVID. So some employee assistance programs, EAPs, were paying for it. Not a lot of medical healthcare insurance companies were paying for it. Now that COVID's happened, they are. And even before COVID, if the insurance companies did pay for it, they reimbursed at a lesser amount because they didn't think it cost as much to do it or wasn't as effective doing teletherapy as it was doing it in office. And now that's changed. It's pretty much got parity. And I know Medicaid is reimbursing for it at a substantial rate, but Medicare does not, which is a little bit ironic. But and of course, there's always private pay to do teletherapy.
And there are many, many therapists that simply don't accept insurance. It's strictly out of pocket. And if you can afford it and want to pay for it, you do.
Yeah, and that's happening a lot, especially I see that in California a lot. They just don't want to deal with the hassles of filing claims and, the fact that they didn't dot their I or cross their T, and sometimes it's 60 or 90 days before they get reimbursed. And also, if they're established, then they don't have to take insurance. And that's why they are going to private pay. And some patients want to go to private pay, even though they have insurance, because they don't want their employer to know that they're getting therapy. So that's how they avoid filing a claim with their healthcare insurance, and they do private pay. So there's no record with their healthcare insurance company.
What do you see as the future of the integration of artificial intelligence, machine learning, patient-reported outcomes, remote sensing with telebehavioral health?
Yeah, I think that's the next gold rush, if you will, is artificial intelligence and machine learning for several reasons. One is, if you're a patient, you're seeing a therapist. It usually takes 1 to 3 sessions before the therapist, kind of figures out or diagnose what your mental health issue is. If you can use, tens of thousands of information to figure out possibly what a patient has before they ever see a therapist, that would accelerate the process. And even though the therapist may want to verify, at least gives them kind of an insurance policy, so to speak, that, what I thought was the issue is correct according to the AI information that have been done for thousands of patients. And the other thing too is that, you can start doing predictive analytics as far as if a person has depression or anxiety, what may set them off by certain statements they make or things they're stating on text messages or phone conversations and all that stuff, and possibly, do predictive analytics and also with people that have substance misuse situation where it may cause them to drink or use drugs to deal with that. And I think, right or wrong, I think some of the big healthcare insurance companies would like that information to know, be a little bit proactive on what helps patients and what they can do to prevent them going to the emergency room for some mental health issue.
So do you see yourself eventually migrating to a hybrid model that is face-to-face supplemented with some non-face-to-face information communication technology?
Yeah, I think that's probably what you're going to see. Some therapists, they've decided they want to just do strictly teletherapy, and they can do that. They're not going to be able to do all patients with that, or be able to see, like I said, people with severe mental health issues. And then there's some that want to do a hybrid, maybe see them in the office at the first session, then alternate and do, one session by teletherapy, the next session in the office, so that if they feel like the patient's getting out of calibration and they're on a video session, at least they know that the next session they're going to see them in office type thing.
Yeah, well, I guess I was referring to the other hybrid, which there's a hybrid of face-to-face versus just online, or both. But then there's the hybrid of online and machine learning, artificial intelligence, bots, chat rooms, text messages, the other online face-to-face communications supplementing the online face-to-face communication.
Yeah, there was a study done in Pennsylvania several years ago about people who had a substance abuse issue and had an episodic event, that they were 30% more likely to contact their therapist through text messaging than they were to see them in person. And the reason is, if I'm going to go see my therapist in person, they're going to say something, well, Mark, you knew you weren't supposed to start drinking, and why'd you do that? And, kind of being judgmental, so to speak. But with a text message, there's no judgment in the text message. And because of that, like I said, they're 30% more likely to contact their therapist to get help through a text message than they are to reach out and actually have an appointment. Well,
we're running out of time. And I really appreciate your insights and sharing your entrepreneurial journey and your business model. I want to ask one final question, and that is that recently a company named Lyra became a unicorn. That is, the company, it does what you do, not exactly the same way, and sounds like not at your scale, but they're worth over $1 billion. They're a telebehavioral health company. So my last question to you is, as a healthcare entrepreneur trying to scale and grow your company, what is the single thing that keeps you up at night?
It would probably be the healthcare regulations, even though that's changing now because of COVID. But, the first thing everyone's out of mouth is, do they reimburse for teletherapy? Well, up till COVID, they kind of weren't, but now it is. And I think getting standards of care to make sure that, just prove that teletherapy is a good standard of care. And the interesting thing about Lyra is that not only are they doing video sessions, but they're also incorporating apps for their clients to use to keep their mental health in check. And I think that's powerful because using kind of apps and AI and machine learning is, I think, the way to go versus just traditional talk therapy through whether it's in person or video.
Well, Mark Nolte, CEO of Start Talking, thanks for talking.
And,
thanks to our viewers for watching, and we'll see you in the next episode of our SoPE virtual chapter meeting. Stay safe.
Thanks, Dr. Meyer. Appreciate it.
Sure.